Guys, we're in the middle of a pandemic and these are trying times. It's hard on our mental health, our mental state. And this is why I love our sponsor today, BetterHelp. They're the largest online counseling platform worldwide. They change the way people get help with facing life's challenges by providing convenient, discreet, affordable access to licensed therapists. BetterHelp makes professional counseling available anytime, anywhere, through a computer, tablet, or smartphone. It's brilliant. Sign up today. Go to betterhelp.com/solvinghealthcare and get 10% off sign-up fees.
COVID has affected us all, and with all the negativity surrounding it, it's often hard to find the positive. One of the blessings it has given us is the opportunity to build an avenue for creating change, starting right here in our community. Discussing topics that affect us most, such as racism in healthcare, maintaining a positive mindset, creating change, the importance of advocacy, and the many lessons we have all learned from COVID. If you or your organization are interested in speaking engagements, send a message to quadcast99@gmail.com, reach out on Facebook at Quadcast, or online at drkwadwo.ca.
Welcome to Solving Healthcare. I'm Kwadwo Kyeremanteng. I'm an ICU and palliative care physician here in Ottawa and the founder of Resource Optimization Network. We are on a mission to transform healthcare in Canada. I'm going to talk with physicians, nurses, administrators, patients and their families because inefficiencies, overwork, and overcrowding affects us all. I believe it's time for a better healthcare system that's more cost-effective, dignified, and just for everyone involved. We are live in full effect. Facebook, TikTok. Quickly say thanks for joining, folks. I thought I'd jump on real quick to do a Q&A. Talk about what we're seeing in this most recent wave. Talk about lessons from COVID, which I think we need to reflect on. There's been a lot of optimism, which I think is well warranted. Absolutely well warranted, because it's been a long pandemic. But but at the same time, there's been a lot of negative press, a lot of media saying why we shouldn't be optimistic. So I just wanted to throw down my 2 cents. So those that are watching on Facebook right now, if you put in NL into your chat box, you'll get our newsletter. You'll get our podcast sent to you directly. This is going to end up being a podcast, I think. Go ahead, press NL into your chat box. Oh man, I'll get into that Fistman study, by the way. It's for real. Okay. First of all, thanks people for joining. Just wanted to give it, once again, put my 2 cents on what's going down in the pandemic. Lessons that we have learned, or should have learned anyway, throughout this pandemic. First things first, I must say that one of the reasons what we want to reflect back on the pandemic is how are we going to handle things in the future? COVID's not going anywhere. There'll be future pandemics, and we need to have a framework that is not based on restrictions, what's not based on closing schools, what's not based on shutting down the economy, what's not based on trying to make our cancer risk and obesity and mental health become more and more of a concern. So I think that having that conversation throughout this pandemic, or throughout like now, on terms of the path forward, is so important. You know what I'm saying? It was I saw Fauci yesterday saying that we're out of this pandemic. And I think this is even hard for people to accept, to look back and say, are we out of the pandemic? Because of how conditioned we've been over the last 2 years. And so when I look at the positives from the pandemic, believe it or not, there's been some really good things that have come through. I can't believe how nimble the medical field have been throughout this thing. And by nimble, I mean, when we had new therapeutic options, when we had new therapies available, say, for example, one of the things we were taught in the early stages of the pandemic is delay intubation. Oh no, intubate patients as early as possible. And we start to see some negative outcomes. So we pivoted away from that and delayed intubations, which I think benefited the patients. We realized we saw patients were clotting and developing clots fairly rapidly. So we started to implement anticoagulation. We started to see that there was there was a benefit from certain medications, mostly like Decadron, for example, or dexamethasone. We saw amazing benefits happening in terms of reduced death and ICU admissions as a result. And we pivoted quickly, which was something I was super proud of, because in medicine, I must say, we're typically dinosaurs. We don't move quick. And so to see that come through in the pandemic, I think it was inspirational. It was fantastic. The other positive thing that was highlighting the amazing work a lot of us healthcare providers do on a regular. You know what I'm saying? That the long hours, the dedications, trying to be great communicators, especially in that time of need, especially when during that first wave where we weren't allowing families to come in. I really think I saw our healthcare providers truly step up and do their part and try and be there for their patients, be there for families in this crazy amount of time and during these crazy times. So there's been some positive things. I look back at that first wave when I was terrified. You know what I'm saying? Like a lot of us were terrified. What's the future look like? Are we going to get COVID? Are we going to be passing on to our families? Are we going to be overwhelmed? And soon, we realized that, we weren't going to be Italy. We weren't going to be New York. All healthcare providers weren't dying in droves. And we were able to have almost like a sense of camaraderie because we had a clear goal, and it was to get our patients through the pandemic, get their patients through this crazy time. It really was a special thing going into work and being part of that team. And I must say that that's a feeling that hasn't left us. And yes, there's been tons of burnout, tons of fatigue, but overall we have moved in the right direction, in a positive direction. But I must say there are tons of negative lessons that we can't ignore. I mean, one thing that I can't believe how much we didn't appreciate was COVID truly discriminates. But what I mean by discriminates is the risk of getting COVID or dying of COVID, being hospitalized from COVID, landing in ICU from COVID is not equal. Number one, we saw age as a clear driver of negative outcomes. We saw what was going on in our nursing home, our comorbid elderly patients. We saw how metabolic syndrome was a huge driver of patients getting sick. But metabolic syndrome, I mean obesity, high blood pressure, type 2 diabetes, massive drivers. And at one point I felt like it was controversial to say this, but during my personal 2+ years of taking care of COVID patients, I've yet to take care of a ventilated patient that was completely healthy. Even the patients that we saw that were younger almost exclusively had obesity, type 2 diabetes. Some of our younger patients were over 300 pounds. And this was kind of a thing that was lost in the media. And so it was hard to see that message not being portrayed to people because, number one, if you know the patients that are at highest risk, let's tailor treatments to them. Protect the nursing homes like crazy. You know what I'm saying? Make sure that they have the resources, the staffing, everything they need during the peaks of these waves. When it came to vaccinations, we knew that there were specific populations of high at risk, so immunocompromised elderly patients, but also racialized communities. Massive, because you know what? They were essential workers. They were our essential workers that were being our Uber drivers, running our factories, running the Amazon factories, being the PSWs that were at the nursing homes, living in multi-generational homes. And it was quite clear, like for them to stay home was not an option. And so when it came to, paid leave, when it paid to communicating risk in these communities, when it came to vaccine rollouts, what an opportunity, you know what I'm saying, to really bring therapy and interventions to those communities that were of high risk. And this was to me such a clear approach that we needed to make. But for some reason, it wasn't about the data. It wasn't about, who's at high risk. It was these attempts to, like, the loudest voices seem to get what they need. The more affluent communities were getting what they need. Like, I'll never forget this. When I was golfing with some like a friend, and he brought his colleagues with him, and they were talking about waiting for their second shot, and they were saying stuff like, "Oh, those guys in the GTA, like, we should get the vaccine ahead of them." Like, they weren't staying home. They weren't listening to public health. So why do they deserve to get the vaccine ahead of me? And I'm like, are you crazy? That dude that you're complaining about is the dude that is like literally making sure you get your basic needs. So literally the one that's bringing your Uber Eats to your crib, the taxi driver, the one that's working in your Amazon factory, making sure that you get your, tidy whities. You're going to tell me that you necessarily deserve to get that vaccine ahead of them. Other things, like when it came to the booster, like when you saw, like when we opened it up in Ontario, it's like, hey, anyone 18 and above can get a booster. And I remember running into a guy that was in his 70s saying that, he had to wait. He's signed up for a booster, but he's got to wait an extra 3 weeks, where that 18-year-old who's more crafty got his booster before him. And so the person that needed the most, 75-year-old pre-diabetic, is waiting for that booster. Like, this is the little stuff that I think we could really learn from and say to ourselves, what are we going to do to really provide interventions for those that need it the most? Because if we look at our primary goal, if it's to protect the hospitals, like, this is what we needed to do. This is what we needed to do, is focus on those that are most likely to land in hospital. It came down to, one of the other things that we saw is how political all this COVID response became. We really created this like dichotomous, or tribalistic approach. It was like either you're pro-mask or you're anti-mask, either you're pro-vaccine or you're anti-vaccine, and there was no nuance. There was no, I'll even say from a personal perspective, when people, so I was one of the first in our hospital group to say we should be masking everywhere. We're seeing, in that first wave, there was some stories coming out of, I forget what nation, saying like, there really wasn't any hospital spread when everybody was masking. And I was like, hey, we can't ignore this. Let's mask up. You know what I'm saying? And then as the data came out in terms of cloth masks, as the data came out that, the impact of, with the impact of Omicron and the fact that we're having milder disease and we're so well vaccinated, are we at a state that we need to vaccinate or to keep a vaccine mandate? And that's a controversial thing to say. Do we need to mask 2-year-olds? That's a controversial thing to say. That's like, we have to have that ability to have open dialogue about these issues. We really needed it. I promise you, we would be better off if we were open to communicate regarding some of these issues. But this is one of the things that I hope we look back at and say, let's not have that cancel culture. Let's have that ability to have open dialogue so we could reduce the harm and maximize the benefit. You know what I'm saying? The last few things I want to mention that I really think we look back on is, like, I hope we never even entertain the idea of locking down again. Like, I mean, look what's happening in China right now. Look at the negative impacts that had with our North American society. We're talking school closures. We're talking with those school closures, increased risk of child abuse, mental illness, physical ailments, pre-diabetic children, their social development, their ability to like socialize and connect with other kids in their primetime years. And they're the lowest risk. They're the lowest risk. Like, when we looked at the risk for kids from COVID, driving your kid to Toronto from Ottawa poses a higher risk of them dying from COVID. You know what I'm saying? And we wouldn't even hesitate to do that. Like, it really became painful to watch what we did to our children. And I think, unfortunately, we're going to pay the price. The kids are going to pay the price. Like, these impacts can be generational, and their education, nobody's validated the impact of virtual school. Like, now we're starting to see the negative scores and the negative, the learning from having the virtual classes. And some kids might benefit. I won't deny that. But overall, our kids are further their steps behind. I've seen it with my kids. I've seen it with the kids around us, and we can't be accepting this and saying that's okay. We can't be accepting the fact that kids were at home with their abusers, and that's okay. We can't accept the fact that some families were having to choose between feeding their kid or trying to teach their kid. Like, that's what shit got real for a lot of folks. You're on the margins. You got to choose between going to work and educating your kids. Like, how are we asking that of people? And we knew this was happening in Ontario. We thought it was okay. We let it go. We let it go for one of the longest school closures in North America. Unacceptable. We can never do this again. You know what I mean? Not to say what the impact has been on our, when it came to cancer screening, like the amount of late cancer diagnosis is now. When it came to elective surgeries, when it came to the surgical backlog now, like, that's not benign shit. Like, that's real. That's people's lives. And people think the economy, like, who cares the economy? Like, who cares about money? Why you bring that up? Because socioeconomics is life. It's health. If you can't afford food, you ain't doing shit. If you can't afford an education, you're now you're further behind. Like, you're not getting as far as you can get. And we think this, and we find that to be acceptable. I can't explain how willing we were to damage our youth. Like, I can't believe it. Even now, when you're a university student and you can't put a foot on campus unless you're triple vaxxed in some colleges and university. That's insane. I'm sorry. Like, the lowest risk group being triple vaxxed in an Omicron era, it doesn't make sense. Like, tell me how it makes sense. I must say, overall, Omicron did change everything. Omicron changed the game in so many ways. And we were blessed to have the milder variant, and yes, it was more contagious, but in a state where we were so well vaccinated. And the other thing it did is that it exposed folks to COVID. They saw people get COVID. It wasn't a mystery anymore. Families were getting it, their friends were getting it, and all this stuff was happening. So they realized, like, it's not necessarily, obviously it's serious, but it's not necessarily everyone's dying that gets COVID. It's not everything. It's not where you're necessarily being seen through mainstream media or Twitter. Don't get me going on Twitter, by the way. That's some mad ass, ridiculous, psychopath, crazy folks that Twitter is medieval right now. I try to stay off that shit, right? Like, just to keep it real. But where am I going with that? Well, I guess what I'm saying is Omicron, it really did change the game, but and like not only from the exposure to people about to COVID, but creating that hybrid immunity. This is one of the things that I will say, like, in terms of what the future looks like, I'm much more optimistic because we are well vaccinated and we have that level of hybrid immunity because of this Omicron wave. Like, I see numbers like 75% of the population potentially have already been had a COVID infection at this point. Like, the community immunity between vaccines and infections has got to be high at this stage. And so when we go into a future wave, because there will be other waves, there will be a wave 7. My humble opinion is it's not going to impact hospitalizations in the same way that previous waves have. And just to give you a reflection on what we're seeing today. So today is April 28th when I'm doing this. In Ottawa, we have very few COVID patients in ICU. And the ones that we have in ICU are predominantly incidental COVIDs, meaning that they came in for another reason, but when you swab them, they were COVID positive. And so, it's been a different beast. Has there people been sick with COVID? Absolutely. But the characteristics of those folks right now is they're either unvaccinated or immunocompromised, meaning they're like on high levels of immunosuppressants or medications to suppress their immune system because they're a solid organ they received a solid organ like a renal transplant or something along those lines. This wave, it really has been a different wave. And that's why I feel like we can have some optimism. And maybe my last message is that is we needed to provide people with hope. I could not believe how much negative messaging, how the communication was like fear, 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 fear. It wasn't based on data. It was based on what's going to scare the public and get them to listen, as opposed to being, you know what, folks? Like, I just wanted my leaders to just step on a mic and just say, you know what, folks, right now, third wave, this is a tough time. Hospitals being stretched. But you know what? We are going to get through this. We're going to get through this by vaccinations. We're going to get through this by putting resources in places that need the most, the interventions the most. We are in a tough time, but we will get through. This is why our healthcare providers are doing what they're doing. We're going to provide them with the supports that they need. But as a society, we're going to get through it. We're going to get to a state where we'll get back to normal life. This is what we expect. This is the metrics we're looking for before we get there. But this is the expectation. This is where we want to go. Giving people hope. Because look at, the amount of mental illness right now. Like, my wife is a psychologist. You see it with the level of burnout. Like, we need to give people hope. We need to that needed to be part of the messaging. That needs to be part of the communication. I hope we learn in the future that this is part of the equation. last couple of things I must say, and the other reasons for hope, milder illnesses, hopefully with future variants, but we now have therapeutics, We now have Paxlovid. We now have monoclonal antibody treatments. Fluvoxamine, for some reason, has lost favor, but studies are showing that to be effective at reducing hospitalizations. So, there is reasons for optimism. And I want that to be a message moving forward. So this is all I wanted to say about lessons from COVID. Once again, keep that hope. Keep that. We're going to keep on our show. What I want to do is talk a lot more about recovery. How are we going to get out of this with some energy and catch us up? Because we are definitely, when it comes to education, when it comes to our physical health, when it comes to, the elective surgeries, ensuring that the cancer screening is caught up. We need to be recovering. And I think this is an important part of solving healthcare, is how do we do that? And so this is part of the dialogue that we want to have. And so once again, we're on Facebook. Just type in NL. You'll get this. You'll get our content. Also, we got our Facebook page on Solving Wellness. Please check that out. Facebook.com/groups/Solving Wellness, where we trying to reduce burnout amongst healthcare providers, doing some pretty exciting stuff. Thanks for